Why is the brain so important for longevity?
Everyone suffered from fatigue. And that's why I say looking at the brain at earlier ages before the physical symptoms present, if we already have an inflammatory process going on, that's going to exacerbate illness. And it's going to make you require using more tools than you may not need to.
Dr. Cornish onto the podcast. She is a board-certified physician. She specializes in neuroinflammation, chronic infections, and brain longevity.
Your ADHD can beat your hormones. Your ADHD can beat menopause, perimenopause. Just like with dementia, there are changes that occur on brain scan imaging way before they appear clinically. And their neurologist might tell them, oh, you don't have that clinical presentation, but they still have memory loss. And you look at their brain and you say, wait, there may be something else we need to look at. Brain health is gut health. You want to optimize the good and balance out the bad, and making sure good deficiencies like something called bifidobacterium. There's a lot of research that one strain helps with brain so much. In chronic infections, post-COVID, the literature is dense.
Today, I am so excited to welcome Dr. Cornish onto the podcast. She is a board-certified physician and the functional medicine director of Eboni Clinics. You guys have heard me talk about that before, the East Coast division, where she specializes in neuroinflammation, chronic infections, and brain longevity. She trained at Brown University, completed her residency at Georgetown, and conducted research at NIH as a Howard Hughes Medical Fellow under Francis Collins. She is nationally recognized for her work on Lyme disease, mold illness, SIRS, and long COVID, and serves as president-elect of the board of ILADS. She is the creator of the Eboni Clinic's 2-week neurointensive program that is currently building neurolongevity, a framework for protecting and optimizing brain function across the lifespan. Welcome, Dr. Cornish, to the podcast.
Thank you. Thanks for having me.
Of course. I'm so excited to have you here. I haven't had anyone from the Eboni Clinics on the pod actually yet. So really excited to have you here today.
All right. Well, let's get it started. Let me represent.
Yes. I mean, for anyone that's listening, we were just chatting about it before we turned on the pod, but, I did the brain health practitioner health coaching program or coaching program. I think it's changed now. It's only available to providers at this point. Yeah. So
yeah, it's expanded a bit, but we still have, non-provider access to training and teaching, we do lectures, we go around the country, but we still have that at the clinic as well for those who are just interested in learning more about SPECT imaging and brain health.
Yeah, I love it. So, it changed the way I thought about things. I think we always want to think of the body first because it's what we physically see, and the brain typically lags. Once you start forgetting things, maybe you think about brain health. But doing that just flipped my perspective completely, and I started thinking, okay, what can we do for the brain? Because as Dr. Eboni says, I'm sure all of his catchphrases are so familiar to you, but it's the most expensive real estate we have. So
it is. And mental health is brain health, body health is brain health. And like you said earlier, you see the changes in the brain scan before they present in the body. Yeah. So that's key to understanding those root causes. So that's why I love it.
I always like to ask before we really get into it, it sounds like you originally were on a little bit more of a conventional path and now you've switched to functional. What was it that kind of made you interested in the functional side of things?
So let me tell you something. I have the non-traditional route because I started in family practice.
Okay.
And I was looking on Craigslist for a couch. Craigslist.
Okay.
And there was a job in the classifieds that said for doctors who think outside the box. And I said, okay, I'm outside the box. Why not?
Yeah.
And so my first practice specialized in tick-borne diseases, Lyme disease. Now, originally, I'm urban. I'm from Detroit. I worked in D.C. And I just remember seeing one Lyme patient and gave them a dose of antibiotics and kicked them out of the office, right?
Yeah.
And so I didn't know much, but I fell in love with it. So it was like 16 years ago now, one of my first jobs right out of residency because I only did a little bit of primary care beforehand. And when I started seeing these complex chronic conditions and these patients coming up that I remember on my rotation sitting in psychiatry because they made no sense.
Yeah.
And then as I first went to my first IFM training a few years later, it expanded and I realized these things are not necessarily infectious only. It's an immune system, it's a body system, and you have to treat the entire patient. And so once I started learning that, it was no turning back. I became an addict. And then I transitioned into brain health because my first Amen Clinic patient, this is around 2012, was a woman who the medical director at that time in the DC clinic, the daughter had psychoses and depression. And her brain scan was abnormal, looked inflammatory, and she had failed so many medications. And when she was sent to my practice at the time, my former partner and myself, we treated her, and she got better. And she got off all of her medications. And so that's when we knew, look, neuropsychiatric manifestations of chronic disease, you won't know until you look. And it could get these patients off medications or other things that are masking their real condition. So I fell in love.
I love that. I mean, it really is the only way, right? Like once you really think about it, like, oh, there's a root cause here. Because it was interesting. Like when I was running my clinic, I would interview, 50 doctors to find one that thought in like a root cause functional medicine type of way. So I think it's so profound once we look at a person that's like the entire body. So with the Amen clinics, I mean, Dr. Amen has done all the celebrities now at this point, and I'm, maybe you've been involved in some of those, but it's also really still controversial that you're going to do a SPECT scan.
Yes.
I saw Dr. Amen on a podcast recently, and it's a doctor that hosts the podcast. You probably know which one, but he was really being pretty aggressive in his line of questioning, like, why are you doing these scans? To me, why wouldn't you do a scan to look at the brain? But can you talk a little bit about what a SPECT scan is, why the Amen Clinic is doing it so differently, and what you guys are kind of doing?
Yeah, so it's a 3D image of your brain. So it's a functional image. It focuses a lot on blood flow. It looks at areas in the brains that are working too active and are not as active as they should be. So it gives us a sense of just brain anatomy and just like neuroscience at a fundamental state. So when I'm looking at brain scans, I'm looking at blood flow in these conditions because I see that it decreases as we age. I'm looking at inflammation because, with chronic infections, there can be patterns neurologically that show on the SPECT scan an inflammatory pattern, which makes you question, hey, is this fatigue or psych or memory, or is this something deeper that needs to be worked up? Maybe mold or Lyme or EBV, just doing that due diligence to figure out what's that inflammatory cause. And you can look at things called deficits, which show that we need to stimulate certain areas of the brain. Now, we have expanded so much. The foundation is understanding that mental health is brain health. And we look not only at SPECT scan imaging, but if you do like a functional medicine assessment of your brain, you get lab work. So you're coordinating your biomarkers and your lab work. We have functional medicine doctors who work and coincide with functional psychiatry to really help optimize the brain. And the brilliant thing about Dr. Amen's algorithm is that looking at functional imaging can also help better understand what we consider mental health issues, which I like to say are brain health issues, right? Yeah. So that algorithm alone has really changed, the field of psychiatry. But more importantly, where I look at it is more of the field of neurolongevity or brain health. And you can't argue with the science. It's black or white. Either when you look at your brain scan, you're going to have brain envy and want that brain, or we're going to show you how we can improve it from a functional standpoint so we can look before and after at that activity and blood flow. And it's fascinating what I see every day, and some people might even be stuck. I don't know how many patients I see, they failed treatments. They tell me I have reactions to everything, and they go through all these different meds, all these different consults. They still don't know what's wrong with them. They can't tolerate a pill. And then you can look on their brain scan and you can say, ooh, they're in limbic lock. They're stuck. I need to calm that brain down. I don't need to give her stimulants, So those are key pieces of information that are helpful when you're trying to accurately diagnose someone's neurological conditions. It's a real good picture of what's going on.
Can you talk a little bit about, too, that, you're able to really kind of parse out, dementia or Alzheimer's? There's multiple different forms, right? And multiple different causes. And there's multiple different forms of things like, ADHD, right? So you guys can see kind of what's occurring in the brain in those. Can you talk a little bit about that?
Yeah, so, ADHD, right? That's really what the functional psychiatrist, and they look at the different types of ADHD. And based on the brain scan imaging, there has been shown to be some variation. And that way they can then treat appropriately. If that's with stimulant, which is rarely used, they use more functional nutritional supplementation or lifestyle behavior models. So that can help parse out why this person is not responding appropriately to that therapeutic intervention and what subtype of ADHD that person has. Now, what I do, I'll work with that ADHD patient, and if I see that there's more of an inflammatory pattern going on or something that I need to look different and deeper, I might say, hey, is this pattern sleep apnea? Is this pattern make me think more of infections that might be messing with your frontal lobe, the front of your brain, and your focus? Let's look at the root cause of this, because we might not want to just mask it with treatment to improve your focus. Your ADHD can be your hormones. Your ADHD can be menopause, perimenopause, Lyme disease, chronic Epstein-Barr, sleep apnea. So having that inflammatory blood flow activity, those patterns can let you know you need to ask important questions. And just like with dementia, there are changes that occur on brain scan imaging way before they appear clinically. And not only that, I see time and time again patients who've been diagnosed with dementia or Alzheimer's, and their neurologist might tell them, oh, you don't have that clinical presentation, but they still have memory loss. And you look at their brain and you say, wait, there may be something else we need to look at that could be affecting your memory. And I'll never forget one of my first patients, because we have a memory program at Amen Clinics where we do an intensive workup, look at the brain, look at the lab markers to really work on that brain longevity by using this algorithm Dr. Amen has created called Bright Minds, which looks at medical, infectious, and all the root causes. And so I remember she came in and she was so sad because her neurologist had put her on all these meds for dementia, and her MRI was normal. All her imaging was coming back normal. And they were just telling this is the way it's going to be. And then when we looked at her scan and I saw what we call scalloping, which is an inflammatory picture, decreased activity in the top of the brain called the parietal lobe, I knew to do the testing. And we tested her for Lyme disease co-infections. And sure enough, she had one. And it wasn't like I looked at the scan and said, oh yeah, this is what it is. It said, hey, why is this there?
Yeah.
And when I treated her for underlying infection, her memory got better. And we wouldn't have known to do that workup unless we had looked at her image.
Yeah. I mean, it's amazing. Even, I've heard, people diagnosed with Parkinson's and MS and all of these different, devastating diagnoses. And if people are able to, which, this stuff is not typically covered by insurance. Correct me if I'm wrong.
Well, we do like care credit. And then
Okay.
there are different prices depending on what kind of scan you have. So we have over 10 clinics around the country, right? And sometimes you can do one scan, which a lot of patients who have neuroinflammation do. So my patients who are worried about more of a functional medicine piece, they can do kind of one scan with me. And I'll read that one scan based on inflammation, like what's really going on with your underlying health condition neurologically, because how many people are tired?
Yeah.
And then you can do 2 scans at clinics as well, because we have functional psychiatrists, tons of them, and doctors who work all around the country and even consult internationally. And then you'll focus not only as much as just inflammation, but psychiatry, things we mentioned, ADHD, root causes of depression patterns. But more importantly, you get on a really good plan for healing and you look before and after. Because there's so many patients, I look at their scans, they're coming to me, I have Lyme, I have mold, I've been treated all these years. And then I look at their scans and they're not that inflamed. They just have problems with blood flow. So things like hyperbaric oxygen might help that type of patient, or just calming the vagus nerve because they're so stimulated and they don't know why They're stuck. Their brain doesn't feel safe to heal. And I can see that. I can see that limbic system too active. So it helps me change my approach depending on what the patient presents with. And especially our patients are always stuck. They've been treated by doctors, psych, med, functional meds, still don't know what's wrong with them. So we kind of give them that answer.
Yeah, I love that. To ask a quick question about the hyperbaric, let's say there's low blood flow and then they're doing the hyperbaric. Typically, from what I recall, the first prescription typically from Dr. Amen would be 40 sessions.
Yes.
Is that right?
Yes.
And then after that 40 sessions, can the blood flow pick up on its own, or are you always going to have to be doing something exogenous to improve the blood flow?
So that's an excellent question. And what I found in the research, because, before joining Amen, I worked at a clinic where we had a hard shell chamber as well that went up to 2.4 ATA, which is the level where you get more of the immune support, you get the antimicrobial where you're killing organisms, whereas low pressures, you're doing more of the neurologic, 1.3, 2.0, you're getting that blood flow. We can treat strokes, we treat patients monitoring for especially long COVID and infections where blood flow has decreased. So I can't necessarily say in every case that it's for the rest of your life, right? Because sometimes we know that hyperbarics decreases inflammation, but it also leads to regeneration of new blood cells and new nerve cells. So sometimes patients might just need to do a systemic enzyme like a nanokinase or a lumbrokinase, Baluch, things that increase blood flow afterwards, or a natural blood thinner, right?
Yeah.
And then aerobic activity, the easy things.
Yeah,
just the easy things, sauna. Yeah. So, I always tell patients, look, your body is beautiful. You can start fixing this on your own. We're just going to give you a boost, and you're going to make that decision to help yourself long term. And it may not require expensive, treatments, but I think there is some need when you're trying to jumpstart that process and have a maintenance approach to it.
Yeah. Yeah, I agree. Obviously, I have a chamber right there behind us, and it's kind of convoluted because obviously I talk about the basics being most important for longevity, but then things like hyperbaric can the way I see it, it's either getting you to that last little percentage of what's possible if you've already optimized everything, or, expediting some healing that needs to happen early on.
Yes.
So I love that line of thought. Why is the brain, so important for longevity, or why should everybody listening? Because as I mentioned before we started recording, I think most people are thinking about their body, thinking about their weight, thinking about how they look in the mirror. And that's normal, right? We see that every day. We don't see our brains.
Yes.
Most people are not thinking about their brain health until far too late. So why is, I would almost say, flipping the script on how we think about longevity and putting the brain first so important?
I think that it's for so many different reasons. But first and foremost, you need your brain for everything. If you're tired, if you're sad, how many people look good, but they don't feel good? And everyone suffered from fatigue in their life. As you age, you might think of brain fog, but you don't want to wait. And that's why I say looking at the brain at earlier ages before the physical symptoms manifest can prevent those outcomes. And I love looking at the brain. I think that everyone, even if you can't do necessarily an image, but having biomarkers of what's going on and your level of inflammation, because you don't want to mask that. You can get the anti-aging support that you need. We can get the hormones optimized, but if we look at the brain and you already have an inflammatory process going on, that's going to exacerbate illness. And it's going to make you require using more tools than you may not need to if you intervene earlier. And, a lot of patients do get that misconception. Oh, I'm looking at my brain if I got dementia or memory. No, you're looking at your brain if you think.
Yeah.
If you want to reserve it, if you want to keep it young. And I think of it as anti-aging of your brain is so important and vital in everything we do.
Absolutely. What are some of your favorite biomarkers that you're looking at specific to brain health?
So I do a lot of, Vibrant Labs. I like their neural zoomer. So when I'm treating someone, because some of the conditions I treat a lot of patients pediatric and adult who have neuropsychiatric conditions that can be caused by autoimmune disease, meaning their immune system is in overdrive and it's attacking them. And a lot of times you'll see what's called autoimmune encephalitis. So infections that have crossed the blood-brain barrier and cause this inflammatory process. So those are antibodies that I look for. And that's why I do Zoomer testing, where you look at things like anti-dopamine. You look at anti-GAD. You look at, anti-calmodulin, those things that help me better understand, is this neuroinflammatory process infectious in nature? And there are so many others. And I even look at cytokines, like the IO interleukins is what they're called, that you can get from LabCorp or Quest, your standard lab, that help me understand. And of course, if I'm thinking of dementia, I'm doing those inflammatory brain markers as well. And, if I'm thinking Parkinson's, thinking tau, there's so many different tests that you can get for that in MDA. It's just, the list goes on. But it depends on the patient. But sometimes I'll just do that initial screening for autoimmune conditions. And I'll have like patients who might have COVID, or my pediatric patients who might have had strep and they change overnight and their meds for psych aren't working, or my patients who've had chronic infections and they're on every hormone support, supplement, brain supplement, they've done hyperbarics, but it's an autoimmune encephalopathic picture where there's an infection or a toxin. And those are the markers that I focus on because they affect everyone and they can improve as you improve your immune system, but they'll progress if you don't think about it.
Yeah. If you had to say like 3 to 5 lab tests that are relatively accessible, if that's possible for anyone listening, just to get a gauge of where their brain health is. Let's say they're not symptomatic,
Yes,
and they just want to get an idea of like longevity brain health stuff. What would you recommend looking at?
So I really would recommend you got to look at your hormones, right? Because hormones, yes, thyroid, female, male sex hormones, cortisol, they can be abnormal at any age, okay? And even if you've had traumatic brain injury or just any kind of sports injury or concussion, car accident, those hormones, their adrenals are suppressed. So and that's like my first step in any patient is looking at hormones, all right? Because that's a marker of brain function.
And may I ask a question on that point? What exactly are you looking for? Like, obviously, so estrogen, progesterone, LH, FSH in women, like testosterone in men, and then cortisol on both
So I'm looking at DHEA and testosterone in women as well. I'm looking at thyroid panel. So I do a complete thyroid, which most people just do TSH. So I'll do TSH, free T3, free T4, reverse T3. I'm looking at vitamin D levels as well because that's so important. I'm looking at their cortisol response. And I'm looking for markers of insulin, prediabetes, all of that can be associated with neurological changes at an early onset, and also gives me an insight on how I should be looking at and interpreting their brain analysis. So that's just kind of the easy breezy workup that anyone can have done. I'm also looking at markers before we get to kind of the functional imaging and the functional biomarkers. I'm just looking at inflammatory markers that anyone can get drawn, like non-specific markers, C-reactive protein. I'm looking at ANA, which are very easy. All of these are tests you can get from LabCorp or Quest just to see the level of body inflammation. Special markers like C4A or TGF beta 1. All LabCorp, Quest, typically covered by insurance that can give me clues as to other types of inflammation. Should I be thinking of environmental toxins? Should I be thinking of how to calm this body down? This body is on fire. And then if you're suffering from chronic disease or even mental health, or you're just being treated and not better, then there are labs like LabCorp has a whole autoimmune encephalopathy workup that you can get covered by insurance, which looks at over 20 different autoimmune antibodies as an initial screening test. So those are like some of the basics markers that I'll do. And then depending on what they show, that's where the detective hat comes on and I start looking deeper.
Yeah. since you've been practicing, how have you seen an increase in autoimmune conditions?
Oh, yeah. And I think that's just around the country. I think it's just yearly because people don't really understand that concept of autoimmunity. Autoimmunity just means something is making your immune system so active that it's targeting you. So there's always a trigger. A lot of times when I'm meeting a person with autoimmune disease, if it's not from birth, or it's always a genetic risk, right? But if they're diagnosed later in life, I always ask them, they always like, what? Why do you think you have autoimmune disease? And they're like, I don't know. And so because I see so much adult onset autoimmune thyroid, autoimmune markers that might trigger or look similar to lupus or Sjogren's. And it's just really meaning that there's something deep in you. We need to look at the root cause that is making your immune system go haywire and start to produce antibodies to your thyroid, antibodies to your muscles. But the brilliant thing that ANA, like especially me treating chronic complex diseases like Lyme disease, there's something cool. It's called molecular mimicry. So let me break this down. So what happens is that infections like tick-borne disease, for example, it's so smart. Those infections are so smart. They can integrate their DNA into your DNA. So when your immune system, which is supposed to get rid of the bad things, it goes in the environment to survey. And now it's looking at your own cell that's morphed into something foreign. And so it starts to attack you. And that's molecular mimicry. And that's also what happens quite often with these autoimmune, what we call encephalitis, which just means a neurological infection, these antibodies being created because your normal cells look foreign, but they can go away. That's the brilliant thing. People think autoimmune is just like this disease complex is going to last for the rest of their life. I have seen patients show up, they get these tests, and they're like, I've seen a rheumatologist, I have a positive autoimmune test for lupus. And I'm like, really? Let's see what's going on, inflammatory. Let's recheck that test. And a lot of times they may go away, the ANA may go down. Not to say some people don't genuinely have autoimmune disease, but you still got to look at what's exacerbating it. And a lot of doctors don't think of that. They're just ready to dismiss it.
Yeah, I mean, it's amazing. I mean, we could like speculate, why are autoimmune conditions through the roof? I mean, I think obviously it's just everything, right? It's like the gut and the leaky gut constant and the processed foods and the environmental toxic burden. I mean, I'm so glad. Like I've been doing the total toxic burden from Vibrant for about 6 years, about 4 times a year. So I have a very clear baseline. And, I went from my goal is always to have 0 toxins in the high range.
Yeah.
And it's wild because when we would do this test at my clinic, everyone would come in and think, well, most people would come in and think, oh, I'm not going to have any toxins because I'm living really healthy and I filter my water and I filter my air and they would come back and they would still have, 15 or so toxins in this elevated range. And we just live in an environment that is like, catastrophic kind of on our health if we're not being, unfortunately, like you have to do things in order to be healthy these days. It's not as simple as it used to be. Would you agree?
I totally agree. And, that's the brilliant thing about longevity. You're trying to optimize wellness, but there's never perfection. And like you said, we are all toxic, but it just depends on how well your detoxification pathways work. And yes, we're all exposed to toxins, but is that what's really making you ill? And so when I'm doing my workups and I use the toxin panel and I use the gut zoomer, which also looks at gut toxins as well, and their toxic zoomer I love, but then I ask myself, okay, that's where the detective works come in, because you can have these biomarkers. Is that really your problem? And let's detox you and figure out why you can't clear that. Because I never find a person who's like coming in and I think they got that toxin exposure yesterday. They've had it for years. If you're being proactive, you definitely want to clear it out. You don't want to wait until you start succumbing to symptoms of the brain fog, of the fatigue that happen as a result of this toxic burden. So I'm always training patients for toxicity, but also helping them optimize just the normal, natural ways your body can detox just for a baseline, to be proactive in general so you can deal with those toxins you're exposed to, because you're not going to avoid them. I mean, we're not going to live in a bubble.
Yeah.
We're
I
not
mean, I
there
live
yet.
pretty close to one, but
I know this is a beautiful bubble.
yeah, we're monitoring the air quality in every single room right now. We have all the lights are non-flicker. We have all this furniture was custom made, so it's low VOC, wool rug, the whole 9 yards. But still, I mean, even someone like me, you travel, you get glyphosate, you live in the world, and things occur. Especially sometimes it's in your environment, and you have no clue. Like you could live next to a chemical plant, and you have no idea.
Yes.
It's pretty wild. And in the LA fires, that was just such a crazy time because all the things that weren't supposed to be burning, from dry cleaning chemicals to molds and mycotoxins to like old school chemicals that aren't even legal anymore, but they were just about. I had some of those. So, and if I didn't know that I had that exposure and didn't really actively, try to detox it, then I mean, who knows how long it could have lingered around. So.
Yeah, and I feel so much healthier just sitting here.
Oh,
Right? But honestly, we had a study at Amen Clinics where we were giving complimentary brain scans to firefighters because, and also doing workups, trying to improve their brain health because there were so much inflammation that occurred. So we were doing things like, glutathione, intranasal. We were doing antioxidants to help these firefighters and just giving aggressive ways to help them detox, but more importantly, giving them that brain imaging assessment of if there's an inflammatory burden. And it was fascinating. And even a lot of my patients, I have a lot of patients who live in LA and they were affected and they may have just had optimal health and lifestyle. But when you get that type of exposure, you're at an advantage if you're living perfectly and optimally. You're at a great advantage, but everyone can be susceptible if their body and their environment is overwhelmed. And I see that a lot in patients with water damaged buildings. Can't tell you how many patients I treat with mold and they don't know it. They have new homes. They lived in, remote place. They're living in they're doing everything perfectly, but they don't know that that's a water damaged building that's causing them to be sick because genetically they have just bad genes and we can't clear that toxin out your environment. So that's another reason why I do genetic testing on top of just the biomarker, because that's all a part of neurolongevity as well.
Yeah. Yeah, I mean, I have a little bit of a compromised detoxification, so it's another reason why I have to, further stay on top of that. And it's so hard to find mold. Like, I mean, you can have 5 people come in to check for it and they won't find it. It's wild. Like I've gone behind people before, like with cash, and I'm like, find the mold and I'll pay you extra. Like tear open the wall. It's so hard sometimes. I mean, there's obvious mold exposure, right? But a lot of times it's so hidden. And even when we didn't build this home from scratch, and I know this is like very extreme, but my audience is going to be used to that from me. But we're probably going to buy the land next door and then we'll build totally from scratch with a biological home builder who someone will literally sit here and check and make sure. Because if it rains and then it's humid out, those timbers that the house is being built with could have mold exposure,
Exactly.
And then, so it's just, it's super difficult. I mean, I do the ERMI test, and then obviously I pair that with the mycotoxins and mold test. So it gives you a pretty good, I think, overview.
Yeah, and I do that quite often too, because that's a question that I'll ask before I see a patient, if they've had a brain scan, I'm looking at that scan, like I told you earlier, and I'm looking for that scalloping inflammatory pattern. And that's one of the questions, a key question I ask patients, because they'll tell me all day, no, this is a new home, or I've already had it remediated, or I've moved into a new home with moldy furniture. I ask them simply, do you feel better in one environment than another? And they say, what do you mean by that? Well, when you're at work, how do you feel? Are you foggy at work? Are you tired at work versus at home? When you're on vacation, is it just you're in a clean environment versus when you're at home? I had my favorite patient. She's like, Dr. Cornish, I'm healed. My brain fog went away. I did her biomarker test again. All her mold numbers went down. And she's like, it's because I got a divorce. I'm like, no, it's because you left that toxic environment. And the common question I'll get when I'm doing my, mold toxin, your mycotoxin testing is, should I test my whole family? And I always tell patients, you should first do the genetic test, HLA mold test that you can get through LabCorp to see if you're genetic susceptible to retaining mold toxins. Because just if one person has a toxic reaction doesn't mean everyone in that family has the same DNA, because mold has been around forever. We've been in mold forever, but it's more aggressive now. And because our bodies are already inflamed by all the other toxins that we live in, then we're going to have like mold put that cherry on top and just push us over the edge. So I screen a lot of my patients, either with biomarkers like urine tests, but even if they can't afford like a urine, mold test, I'll do the blood work that is covered by insurance, which just is called chronic inflammatory response syndrome blood work markers to see if that's a problem and if they're inflammatory or genetically predisposed to mold toxicity.
I love that. What are some of your favorite treatments for people with mold?
So first you got to move out the environment and test it. So like you said, ERMI is a great test. I also use immunolytic plates, which are also really inexpensive. It's plates and you can put them around their home and see if things grow. They're very reputable. They give you good data. Sometimes I'll compare what's in the home to what's on the patient's test as well. And depending on what's there after they've moved out of their environment, some people can tolerate binders. Like if their bowels are regular, typically I might start with a clay, or I might start with charcoal, or, okra, pepsin, pectosol C. It depends. Or I might have to kill the mold in those patients. So that's when we're talking about antifungals. I might do testing and find they have nasal mycotoxins, so mold in their nose. So I might have to do nasal sprays. I do things like sauna, exercise, the easy breezy things to just get those toxins out our body, Epsom salt, because we can naturally detox as well. And the list goes on and on. But I don't necessarily have just a protocol. It's really individually tailored on the labs, the biomarker, if someone's blessed enough to be able to get out of that moldy environment or not, because sometimes people who are living in mold and treating mold, if they don't have optimized liver detox or bowel health, they may get sicker because you're binding and pulling these mold toxins out, breathing them in every day. So it's like a vicious cycle. And sometimes people just can't handle it because they might have detox problems and you have a higher inflammatory burden, even though you think you're doing the right thing. So it does require, and I always stress this when I train doctors, that you take an individualized, tailored approach for each patient based on that environmental toxin, what else is going on in their body simultaneously.
Yeah. We talked a little bit about ozone, which you guys don't do at the Amen clinics, right? But that would be kind of one of our frontline, but again, depending on where the person was at, they could have a Herxheimer reaction. They could respond poorly to the ozone. So you really like titrating it up because it all just depends on like, are your detox pathways open and where are you at? And are you eliminating things on a regular basis? I think it's also overlooked, just regular bowel movements for detoxification. I mean, it's so important.
That is like when I'm treating a person, I don't care what you're coming to my office with. And I'm like that doctor who sees the patient's already got a binder full of tests before they walked in and 5 or 6 doctors ahead of time. I'm always starting with the basics. Like we said earlier, brain longevity, your biomarkers, but more importantly, the basic hormones that you get with LabCorp and Quest, sleep, which is so important. Brain health is gut health. So it's mandatory, no matter what your patient is suffering from, that you optimize the gut. And I do a lot of gut zoomers for that, to look at those root causes if they have what's called dysbiosis, bad bacteria, because we have trillions bad bacteria that sends bad signals, good bacteria that send good signals. But majority of time we have more bad than good. And that's how I explain it even to my children and to my pediatric patients, because you want to optimize the good and balance out the bad, and making sure good deficiencies like something called bifidobacterium. It's a lot of research that one strain helps with brain so much in autism, in chronic infections, post-COVID. The literature is dense. And then you tell patients, look, you're coming to here and you got a closet full of supplements. You're living right. You're doing it right. But is your gut leaky? Are the things you're taking just going out of your body?
Yeah.
And I'll see that a lot. I'll get mineral testing, vitamin testing. They're deficient, but they're coming in with bags of vitamins and nutrients that they're taking. Or I'm chasing these hormones with different supplements to get those levels up, but then they have leaky gut.
Yeah.
Or they're not optimizing that component, so nothing is getting absorbed as well as it should. So stabilizing that foundation when you're going through treatment is key. You can't really focus on longevity treatment if you're not having optimal gut health.
Yeah.
Because the gut and the brain are connected. And so it also requires that I do individual tailored approaches with gut health. Because some patients, I treat kids on the spectrum, they may eat 2 groups, food groups. That's it. So I'm not going to tell them to be gluten-free, dairy-free, sugar-free, all these free if I know they can't do it.
Yeah.
I have to build from where they are, make very creative ways to integrate fruits and vegetables in a fun manner.
Yeah.
The same thing for my truck driver or my working mom who is on limited income. So we know what way to go, but we also have to find ways to get your patients to meet you where you are and build. And once they start seeing that improvement in their brain health and their irritable gut health, they'll continue on that journey. But if you can't treat chronic infections without talking about the gut, you just can't.
Yeah, I agree. I mean, I think the gut is like the foundation of all health, right?
Yes.
I mean, everything we see, my heart just breaks for like women with skin conditions, acne, this, that, the other, and they're just applying creams and creams and creams. And it's like, so much of that is just internal. Start with the gut and work on optimizing that. And then so many, like you said, nutrient absorption improves. I mean, hormone, estrogen recycling can improve things. So many things can improve with the gut.
Yeah. And also mood.
Mood, absolutely.
A lot of the neurotransmitters are located in your gut.
Yeah.
So optimizing your gut is optimizing your mood. When they say you have foods that are pleasure foods, your neurotransmitters are being stimulated. So you have to optimize the gut there. And autoimmune disease, a lot of autoimmune, like you were talking about eczema, and a lot of these autoimmune skin conditions and body conditions, if you do more of an autoimmune diet, that's why we stress that, and you're decreasing foods that are inflammatory, that autoimmunity will improve, but that also your gut stimulates your immune cells. And all my patients, like if they have thyroid conditions, for example, I tell them the thyroid molecule looks similar to the gluten molecule to your immune system.
Yeah.
So it's going to target gluten, the immune system, and target your thyroid simultaneously. And I've seen dietary changes help so much with autoimmune disease, just tying together what we were talking about earlier.
Yeah, that's so important. I love that call out on gluten, mimicking almost, that molecule. So,
Yes.
So important. What do you think? So I think maybe this has a little bit of controversy. I'm not sure. But I, for the longest time, did Genova GI effects. Then I switched to Vibrant Gut Zoomer. So the Gut Zoomer will have these bad microbes linked to something like Parkinson's, for example.
Yes.
How do you feel about that? Because I feel like if we do know this, like if it's, these subset of bad microbes could potentially lead to dementia or Alzheimer's, then we can clearly target that. And that seems amazing.
Yeah. And I think it's more looking at when you look at those microbes, because I am in love with gut microbiology. It's giving you more of a sense of how these microbes, and these deficiencies can cause these, like, especially when you're talking about Parkinson's, and they'll talk about cardiovascular health or neurological health. It's that neurological health, and you talked about Parkinson's and cardiovascular health as well. It's because there's data showing certain subspecies of organisms are involved with inflammatory processes that affect different organs of the body. So it's not necessarily, yes, this is going to prevent you from having Parkinson's or dementia or heart disease. It's more of a, hey, let's balance your gut microbiome, because we have trillions of organisms in our gut. And we're learning about it every day, just like we're learning more about gut, how the immune system works, how it connects with the brain. So there are trillions of organisms. But the brilliant thing is that some of them cause more inflammation than others. And balancing them out is key. So anyone who's afraid of neurodegenerative disease of any type or cardiovascular disease of any type needs to kind of understand, hey, these are some of the organisms that you can balance out, but more importantly, feeding them the right things and suppressing those that may cause those adverse outcomes. So I don't necessarily look at it as controversial, but I think it's more warning signs. It's not giving you a definitive like, hey, this bacteria, you will have this. It's more, hey, the literature shows that these organisms can cause inflammation that could potentially be associated with certain conditions.
Amazing. Well, she's also a trainer for Vibrant, right? So I get to ask all my nitty gritty Vibrant questions.
That's what I'm here for.
So I was like, there's no way that they could have research that's like linking that one thing to that. Is like, but okay.
It's more of an inflammatory burden.
It's like an inflammatory bucket.
If you look at the bucket of inflammation in certain microbes, then you can extrapolate as you're also looking at certain health conditions. But I would suggest, people, when they get that information, like if patients will go, oh my God, they might put it on the internet and Google and think they're going to, suffer tomorrow.
Yeah.
But the overview is let's balance this. Let's balance these microbes. Let's improve the good ones, so that we have brain optimization and lower levels of inflammation overall.
I love that. So I know that you mentioned the bifidobacteria.
Yes.
So that's a good one for brain health. What else do we have?
So Akkermansia, of course, is amazing. There are certain strains of bacteria that can lower histamine. Lactobacillus is certain subspecies that can also lower inflammation. Like there are certain probiotics that are produced now that work on calming the brain. In certain subspecies of bifidobacterium, they do that. But then there's also research showing bifidobacterium, lactobacillus, and certain forms of Akkermansia also can support brain inflammation and help with cognitive issues, with mast cell issues, with learning issues. And they're starting to create things like Zenbiotics, where they're looking at certain subspecies and then adding them with agents that calm the brain like GABA and L-theanine. But more importantly, they're doing more research into probiotics, microorganisms, and mental health.
Yeah, I love that. So important. I mean, if you were to do like one advanced test, would you say a gut test would be, because the gut can also be so complicated, right? Like we know what to do for, let's say, good gut health. We could say fermented foods and all of this, but actually, I mean, from what I understand, if you're loading in fermented foods, but at the same time you have a leaky gut, that's actually probably causing too much mechanical irritation. So the gut can be really complicated. If you were to choose one advanced test, which one would you choose?
So it definitely would be a gut test, and not just a lower gut test. I would look at, the small intestine, because I have so many people, like you said, they're taking fermented foods, probiotics. They think they're doing the right thing, but they're still bloated. Especially a lot of my patients, women, oh, my stomach is completely flat and they're uncomfortable later in the day. We've done food elimination plans and they still have bad bacteria in their stomach. But the one thing we can't ignore is the oral testing, that oral microbiome, because it all goes together. And so I do a lot of oral testing, a lot of oral DNA testing, where I'll get floss samples. I might send them to places like DNA companies, and we'll find the bad microbes. We can even find strep, staph, parasites. And it's the same thing that you balance in the gut, you balance in the mouth. You might create mouthwashes for it, or different types of dental floss, or especially if patients have root canals. I've actually seen test results where patients have had root canals, and you think of, metal fillings, but they need it extracted because they have so many of those infections are still living there.
It's crazy.
It's just no nerves, and they're circulating throughout the body. And I tell patients, how do you think those organisms got in your gut? They didn't just absorb. They got in through your mouth, from what we're eating, from what we're exposed to, et cetera. So you cannot ignore the oral microbiome.
Yeah, I think that's so important. I just did I have been seeing a biological dentist for, I call it like the functional medicine of dentistry, for, I don't know, like 10 years, but staying on top of that is so important.
So important. And it's important for your immune system. It's important for your brain health. One of my favorite patients, he had seen, like, I can't even tell you how many doctors. He'd been overseas, and he had Lyme disease, and he also had mold illness. When I tell you, doing everything he could do, you and him are kindred spirits, but I think he might go to another level. Like, I couldn't imagine all the things he did. I was like, it was like living in a bubble, right?
Mm-hmm.
Basically, not
Yeah.
exposing himself to anything. And then I asked him, did you have a root canal? He was like, oh, I have perfect dental hygiene, but I have a root canal. And we extracted that tooth.
Yeah.
And I didn't see him for a year. And I was like, did he not like me anymore? And he wrote me the most lovely letter about how I was one of the first doctors who looked in his mouth and removing that tooth. And that is like a diseased part of his body helped him. Even though his dental hygiene was great, that tooth was contributing to a lot of his neurological symptoms, not necessarily the underlying things he had been diagnosed with. And he was able to live a better life. That was huge. That changed my life. That just changed my whole practice.
I love that. It can also, it's pretty common too with like wisdom tooth extractions, right? And then getting a cavitation and then having an infection in my biological dentist was explaining to me, and I don't recall the exact stat, but there's just a huge relationship between women having a cavitation and then an infection and breast cancer and even like the tumor being on that side. It's absolutely crazy. I mean, I don't have the data right now to share to support it, but I'll ask her for that. And I'll send it to you.
That's fascinating.
Super fascinating. Yeah. So the mouth is just so important. And what I don't think a lot of people think about enough, and I always have that image of in my head where you can see the teeth are connected to the brain. You know, it's so important for brain health, for oral health, right?
Definitely. Brain health and mouth health are one and the same, just like nasal health. If you're walking around with bacteria, mycotoxins, yeast colonizing your nose, ear infections, you're getting staph strep and you're taking all these things and you have neurological infections, it's all connected. And people don't think about it like, oh, my tooth could be the cause of my my metal fillings can be the cause of this. It's all connected. And I teach patients that, and it helps me, like we were talking before about how baseline our bodies are inflamed. We're already on fire just naturally, right? Because of what we're exposed to, even if we try our best. But then you layer that other level of other parts of the body you're not thinking about. And, it's dramatic what can happen, but it's also very easy. And it's easy to ignore. And I tell patients that all the time, like, we got to look at your mouth, not just your fillings. We got to look there to see what's going on.
I love that. How do you test the nose for anything that's like been colonized? Is that?
Yeah, so I'm looking at nasal, DNA testing. I do a lot of nasal microgen. That's one of my favorite tests where they send it to a lab. Now, with mold illness, a lot of people can have what's called marcons, which is a special resistant form of strep in your nose, right? And that can be treated. Or you can have different type of fungi in your nose. And sometimes I've seen these patients who have this chronic stuffiness or these recurrent sinus infections, and I get their DNA nasal sample back, and it's organisms I've never heard of. And then they are biofilm. So they're all living harmoniously in this biofilm, and their doctors giving them Zithromax and amoxicillin and damaging their gut with all these antibiotics without necessarily targeting the organism that they're sensitive to. So I don't have standard tests that I do for nose cultures, because standard tests look at what's, growing. I look at the genes of those bacteria, because that's how you get to those resistant nasal or microbes. And then I design sprays, according to what is growing there to clean those passages out.
So good. I don't think a lot of people are doing that whatsoever.
Yeah, you got to.
You'll have to give me the name of some of those labs.
Yeah.
I'm curious. With so much mold exposure in the fires, if anything colonized up in there.
Yeah.
Do you think like saline rinses or something that people should be doing? Is that harmful? Like, those neti pot things? I've always been worried about that. I mean, I've heard some crazy stories of like someone getting an amoeba or something in their brain because they used like non-distilled water.
Right.
So obviously no one wants that.
Right.
So is there a way to like keep the sinuses like clear that you like, or?
Yeah, I use over-the-counter things if you can. Like Xlear is one of my favorites. It's few dollars at the store, but it has what's called xylitol in it. So that opens up biofilm. A lot of my patients, when they have viruses or colds or flu, I might tell them to do over-the-counter what's called silver spray, nasal spray that are broad spectrum. Sometimes I have them do different types of, I know Microbiome Labs has a probiotic that you can make as a nasal probiotic, because it's not necessarily just about killing, because your immune system is also boosted by good bacteria. So you don't just want to wipe the entire microbiome, you don't want to wipe out the entire nasal, organisms. You want to kind of balance them. So sometimes I'll have them balance it with good bacteria, nasal probiotics as well, just to get that base approach. But you can do those things naturally to start. And then if it's not getting better, that's when you have to think about it. Okay, you've taken all these methods, you've taken all these meds, but what else is going on? Don't just mask it with a steroid. Is it your environment causing you sinuses? Is it yeast causing you to have this sinus infection? Or like I said earlier, those biofilm, those rare organisms of which you can create specialized, and that's when you're looking at the compounding pharmacies to give you and sprays that are sensitive to whatever organism that they pick up on tests like Microgen. So it's fascinating. And then the sinus is clear, but also making sure the passages are clear.
Yeah.
A lot of people are stuffy. They get recurrent infections and the passages aren't clear, right? And so then they might need to see ENT to help with that. But nasal, gut, mouth. Gotta look at it.
My team recently told me that only 50% of you that actually watch this video are subscribers. If you watch this content and you enjoy it, I would really appreciate a quick subscribe. Take a second to do it now, because the more subscribers we get, the better the podcast, the better the video content can be. So would really appreciate that. Now back to the video.
Yeah, so important. When I was a kid, I had like reoccurrent ear infections all the time. I still don't know what that was about, but yeah, there was something going on there. I mean, obviously none now, but interesting. Okay, well, we talked about, I'm glad we went, I haven't really talked about that at all, but super excited that we went down there. Okay, Lyme, and actually before we get into like more complex stuff, if you had to, let's say, recommend a general brain health longevity protocol, let's just say, the basics. We can go through exercise, sleep, stuff like that. But also maybe a few supplements. Maybe do you like omega-3s? Like, what would you put into this for a healthy person, non-chronic disease individual to really keep their brain healthy?
Okay, mandatory. Vitamin D.
Okay.
Absolutely mandatory. And you can check your vitamin D3 levels with standard labs. You want to have it around 50. That's when 50 and higher are very helpful in the Alzheimer's literature, just for brain optimization. Hormone support is so key. So that's absolutely mandatory for patients to have that support if their numbers require it. That's needed for brain health. Okay?
And do you like that with K2?
Yes, I do that with K2. Okay. I also turmeric, good old-fashioned turmeric, anti-inflammatory, amazing for brain health as well. Omega-3, but you have to have, I like to have a 4-to-1 EPA-DHA ratio. I like to look at those brands, because when you're using supplements, a lot of them can just not be real supplements, right? You're getting sugar pills. But having that omega-3 and also getting these things from your food are so important, because what did we say earlier? Some people might have leaky gut and they're not absorbing a lot of the supplements. I love to use things like choline, phosphatidylcholine is great. Choline you also get in eggs. It's great for optimizing brain health. I use that a lot. And also if you're having memory issues, I might use Bacopa. That's another one of my faves. And glutathione. Those are just things that help. Glutathione helps you detox. So that's kind of like an arsenal I might have for brain health. If I'm worried about blood flow to my brain, like I've had infections, I'm just tired, and I just want to increase circulation, I might use things like nitric oxide supplements or natural blood thinners just to help get that blood flow going. But I test the gut first though, to make sure we have that conversation before adding supplements.
Do you like beetroot juice
I
for?
love beetroot juice. Yes,
Okay,
I
yeah,
love
that's
beetroot juice. I love lemon water. Those are like easy breezy things. I like eggs, omega-3 that you can get from seafood, vitamin D sources. So there are a lot of things you can eat that you can get those same benefits as what you supplement with. So I'm a big fan.
Do you like looking at an omega index at all?
I do. I
Yeah.
do look at that. And I measure that quite often in patients. And I can see when you're decreasing inflammatory burden or even when you're supplementing that it does improve. So
Is there a number that you like to keep it over, like over 8 or?
like 8 or higher is
Yeah.
optimal for my patients,
Yeah.
especially because I have a lot of patients who deal with brain fog and fatigue.
Love that. What would you say is like the minimum exercise requirements for brain health, and how would you separate cardiovascular training and strength training there?
So minimally for brain health, it's 30 minutes a day, right, of some sort of activity is getting your heart rate up. However, with patients that we're talking about with complex chronic illnesses, they may not have the reserves to do that or the ability to do that. So I might start them off at 5 to 10 minutes a day of some sort of cardiovascular activity. Sauna, which the research shows out of Europe that it can be a form of cardiac stimulating activity, stimulate your cardiovascular system. Especially for my perimenopausal and postmenopausal women, I'm doing a lot of recommendations for weight-bearing exercise for their bone health. That's key, and that you're doing that in minimally 3 to 4 times a week every day. But I think that what happens with patients with chronic inflammation and infections, toxins that we don't talk about, is when they try to push themselves to the guidelines that we recommend, they get post-exertional fatigue or crash. So they're trying to do the right things. They're pushing their bodies to do it, but then they crash for 2 to 3 days after. And so they come back like, Dr. Cornish, what's wrong with you? I haven't been able to get out of bed, for 2 to 3 days. So I always say you have to build it because my patient population is general from the general population. So I build it as I go to get them to those evidence-based protocols.
Yeah, I love that. And you would say sleep definitely in
Oh,
there?
God, yeah. Because I'll tell you something. So many patients that I see at Amen clinics or who have chronic conditions, when I'm looking at the brain scan, I'm like, is this a sleep apnea? We have certain patterns that can give us a clue of sleep apnea. And they can be the size, 0, the healthiest person, and not know it. I do so many screenings now for sleep studies and just also sleep questionnaires because if you're not sleeping, your brain isn't healing. And even with sleep apnea, it doesn't have that traditional presentation. This is not a patient who snores or, just is waking up out of breath. They can just have they could just wake up with non-restorative sleep or have those compromised hormones or that brain fog or just feel tired throughout the day, and have interrupted sleep patterns. And that's key. That's the key to neural longevity. That's the key to brain health is having consistent REM sleep 7 to 8 hours a night that is not interrupted. But there are so many things that impair our sleep, like the toxins and the hormone changes, etc. So it is very important that you have an optimal sleep routine or you work with a doctor. And I'm not talking about sleep drugs. I'm talking about working with a doctor to figure out why you're not having that sleep and other ways to help. And I mean, the common thing I tell patients, probably your listeners, scrolling. Having all that Wi-Fi on in the room and scrolling all day and night. Remember my triplets, when they were younger, I had Alexa in their room because lullaby music I thought would get them to bed. I mean, I need to rest. I have 3 kids. They're young. They're crying all the time, but it made it worse. And I'm like, oh, silly. I have Wi-Fi stimulating their brains at night. And, and then the scrolling we're doing, all this frontal lobe dopamine production that we're having all the time with these devices, it affects your sleep, which affects your healing, which affects your brain and everything else.
Yeah. Yeah, I mean, it's amazing because I have my sleep dialed in so well. Anytime, like yesterday I went, I had to attend something a little bit later in the evening, not super late. I mean, I was home by like 6, but I go to bed at 7:30. So if I get home at 6, then that's not enough time really to like completely shift, wind down, take a shower, all that stuff. So that, this morning on my Aura Ring, my heart rate was, a couple beats higher than it normally is. It's just so important how you wind down, the eating really close to bed, things of that nature, stopping eating 3 to 4 hours prior to bed. I found like to be a game changer for me. What are you aiming for? Or do you look at like the amount of REM? So I aim for 2 hours per night of deep in REM. Do you think that's like a good range to be?
I think that's a good range, preferably about 3.
Okay.
That's when you're rock star range. But just making sure your oxygen levels are optimized while you're sleeping. That is so key. I do a lot of cortisol testing, and what I find in patients who have non-restorative sleep is that stress hormone is high when they wake up. But more importantly, it's like a 4-point test. So in the evening, even though they're closing their eyes and getting a good night's sleep, their cortisol or stress hormone is shooting through the roof. And so all night they're closing their eyes, but their cortisol is still being stimulated for whatever root cause reason. So I think knowing your deep REM sleep, but I also think knowing oxygen levels at night for those patients who are fatigued or who are working really hard to optimize brain function and blood flow and just overall decrease inflammation it's imperative, for those patients.
What would you say is the threshold that you don't want to go below? Like, I mean, 95, 97?
No, usually you start, depending 80 to 85 is where we see. Optimally, once you 95 or higher throughout the night, but sometimes you might move or something. So 80, 85 or so is what I'm working on. And then when I'm getting sleep study reports, they're using flagging that, they went all the way down to 80. That's very concerning. And they're starting to mark that off. But ideally, you want to be 95 to 100. But, really kind of the cutoffs are usually around 80.
Do you feel like the wearables are sensitive enough to pick that up?
I think it's better than nothing.
Yeah.
Because I don't know how many people are going to have, continuous monitors of oxygenation saturation all night, right? If they're optimally healthy, or pulsometry, on their finger while they're sleeping.
Yeah.
It's not happening, but I think it's better than nothing, you know?
Yeah. Yeah, I agree. I mean, my stats are always super high, but I'm curious, like if anyone ever does get a low score on like an Aura or something like that. So.
I think that's when you start asking those questions, and then you start getting appropriate, more comprehensive and more accurate testing. You take it to the next level. You go see a provider, you go see a sleep specialist, someone who can help you and give you the more accurate way to test.
Do you ever have someone coming in with like an Aura Ring result and saying like, hey, it's at 80%? Have you ever seen that?
All the time.
Oh, you see it all the time.
All
Okay,
the time.
so then it is.
Yeah, it can go. Yeah, I see it all the time. And then that's the person that I'm doing a sleep hygiene review. And I'm also looking at underlying infections or toxins and inflammation. And I might send them, because home sleep studies, even though there's debatable about the accuracy, but they're so easy to do. Yeah. And they can be a first line screening to having someone who goes to a facility to do one. And they're typically covered by insurance. Some of the ones I use like Snap Diagnostic, AccuSom, among others that are really helpful, easy to use, pretty accurate. But when they get that treatment, may that be a mouth oral device, or that might be positional or wedge pillow, or even when you get as serious as CPAPs, right? BiPAPs. It helps so much with the other imbalances that are happening in their body. Is such a game changer. Then you're starting to get off these other supplements. You're starting to get off these other meds, these antimicrobials, because sleep is needed. And I tell patients when we meet, I say, look, we're going to get better optimizing your gut, optimizing your sleep. If you're not sleeping, I can't do much for you. Yeah. So we got to figure out why you're not sleeping.
Why is there such a, I guess, correlation between being overweight and having sleep apnea?
Yeah.
What is it about?
Yeah, airway a lot of times can be compromised. And also higher weight leads in some cases to higher levels of inflammation. But it's usually, structural a lot of times, as you get, more weight, you're going to have structural changes, airway changes. And so I always optimize lifestyle and weight. Always in my patients. But if they are, of a certain size, and sometimes you can even have nice, thin, healthy people with sleep apnea. So I never like people that kind of have that assumption that, oh, I'm fit, so there's no way, I don't snore. There's no way that I don't have that. But I think that everyone should have that on their radar, no matter what size you are.
Yeah, I mean, it's kind of bold, but what does Dr. Ammon say? Bigger waistline, smaller brain.
That is true, Yeah, that's
It is what it is, I
what it
guess.
is. Yeah, it is what it is.
And why is that?
Well, it's because of what we were talking about before. When you have more weight, you're going to have higher risk of other health conditions as well.
Okay.
Prediabetes, kind of lipid issues. But more importantly, toxins are typically, and this is like the foundation of functional medicine, we see that toxins are stored in fat cells. So there are two parts of detox that occur in the body. So you have these fat soluble toxins that when you have certain enzymes in your liver, so our cytochrome P450, getting a little technical here, they convert those fat soluble toxins to water soluble toxins by using vitamins you have in your body, the B vitamins, glutathione, process is called sulfation. So it converts to more water toxin, water soluble, and then you can excrete it out the system because you really can't pour fat down the drain, right? I know I can't. I don't put oil down my drain, but because it gets backed up. And so that's another key medical part, is knowing that toxins are stored in fat cells. So when I tell patients that, it kind of resonates. So we want an optimal lifestyle, optimal weight, definitely for our overall inflammatory burden, but also our toxin load rises as our fat cells increase.
Yeah, the fat's just like a toxin storage facility.
It is.
And it's kind of like a little bit of a waste.
Yeah, and you can't really clear it until you convert it to water.
Yeah, no, that makes
But it's when it gets hard, you probably have listeners who's like, what is she talking about? That are perimenopausal, menopausal. We get of that age and it's like, no matter what we do, it's harder to lose that weight because estrogen is so helpful. And then also we have this leptin receptor in our brain that when we have mold illness, it's dysfunctional. And that's the part of the brain that's responsible for exercise and diet and losing weight. So we have other conditions that, even thyroid problems or other medical conditions that may make patients have excess weight. So I don't want people to hear this and say, oh my God, I'm a toxic dump, just because I have extra pounds. But I think it is something to be aware of. And if you have those medical conditions, to be treated, like with hormones, to get the consult you need, with inflammation and infections, knowing that they're inflammatory. I mean, I have so many patients come to my office, they just look puffy. They're just inflamed. It's not eating, bad foods or having a poor lifestyle. You just have inflammation. You just have high toxins. And sometimes getting that toxin burden lower in general can also help with your weight.
Yeah. Yeah. I mean, it's like a kind of need to work on both simultaneously, right?
Exactly. You have to. You have to. And, it's just fascinating what I see there because especially the women who have the extra weight with gut problems. Like I said, that small intestinal bacterial overgrowth where they're looking pregnant by 3 o'clock in the afternoon because that bacteria is fermenting and producing so much gas. Their weight gets stuck, And, that's why people are using so much peptides, and things of that nature just to help. But it's more helping process inflammation. But my thing is I look at the root cause of the inflammation, if that's the toxin or the infection or immune dysregulation, whatever it might be. Right?
Yeah.
And knowing that the leptin receptor is in your brain. So your body starts worrying about, or responding to exercise, and losing that weight. It's bigger than just your lifestyle. So I always tell my patients that it's bigger than just one thing. Don't get discouraged when you're doing the right things and the weight's still there. There's something else going on because I see it all the time.
Yeah, this is the first time I've ever heard anyone say that the mold could be influencing the leptin. So what is the mold doing? It's like toggling it because ghrelin increases hunger hormones, and then the leptin tells you you're full to stop you from eating. But what is the mold is like turning off the leptin? So
it's turning off leptin. It's turning off something called MSH because we know mold is neurological. It's turning off interfering with ADH, so more nighttime urination is occurring. So it's just the direct, and this is work by Richie Shoemaker, impact of mold as it crosses the blood-brain barrier and its impact on hormones. A lot of people, they have decreased sex hormones because mycotoxins can affect sex hormone production as well. They have what's low melanocyte-stimulating hormone, and sometimes they'll have sleep problems or they'll just have inflammation as well. So those hormone testing, I look at that sometimes as well because they can also be clues to chronic inflammatory response syndrome, which is what you get due to mold exposure and toxicity.
Yeah. Do you believe that, we're hearing more and more now that Alzheimer's is type 3 diabetes?
Yes.
How do you feel about that?
I do. I feel that very strongly because the higher sugar content, the more damage we're doing neurologically to our brain cells. And I do think that higher levels of sugar leads to gut imbalances, leads to inflammation, leads to neurological inflammation and cognitive dysfunction. But I also know there's a lot of research showing with Alzheimer's and dementia the connection with infections like the herpes viruses and Lyme disease, how that's been, Borrelia burgdorferi has been shown to be in the brain, actually in amyloid plaques. There's actual research that shows that, right? And people who are actively looking on the root causes of Alzheimer's. And then there's that research that shows that people had been misdiagnosed with Alzheimer's, but in fact had mold illness. So we know that that can also mimic this Alzheimer's presentation. And I see people get misdiagnosed with Alzheimer's a lot. Or I'll see people who actually have Alzheimer's, but then you work on some of these other factors and memory improves slightly.
Yeah.
So what we know is there's a mental health component. I see patients who've been diagnosed with Alzheimer's who might have depression because that mental health piece. I've also seen hormones. I've also seen, inflammation, like toxins, like we're discussing, influencing that. Blood flow, of course, decreased blood flow to your cerebellum can cause it. Decreased blood flow to the hippocampus can cause Alzheimer's. And like I said earlier, we were looking at research with infections as well. So an injury, brain injury.
And how does the
brain injury.
depression lead to
So
Alzheimer's?
when you have to do that screening, right? Because what we find with these neurotransmitters, that depression and most of these psychiatric conditions, it could be more of a neurological immune response as well. And then sometimes even with mood disorders, they can mimic features of brain fog or, memory loss. So when I'm screening a patient who has memory problems, like in our memory program, for example, we're looking at their brain and we're also screening out psychiatric diagnoses that could also mimic Alzheimer's as well.
Okay. Yeah. And why do we think that women are like 2/3 of Alzheimer's diagnoses?
I think that it's because of the fact that as estrogen declines, especially, it's related to hormones, we're going to have higher levels of inflammation because estrogen is known to suppress what we call NF-kappa beta. And so as it declines or changes, your inflammatory markers and also your inflammatory interleukins can rise. And that can lead to changes that, especially when I see looking at brain scans across the lifespan, through ages, and especially post-puberty and on, they have at least a decrease in blood flow. It's decreased perfusion. And that is what we see on brain scans. We're looking at just straight up normal brain scans. We're looking at decreased perfusion as we age. And I think in women, it might present earlier because of our hormonal changes that occur puberty, perimenopause, and menopause. That's why a lot of patients who have brain fog or dementia, hormone supplementation is encouraged and can help support brain and memory health.
I would believe it would be reasonable to say that you could just get on like bioidentical hormone replacement therapy. Does that kind of ameliorate some of these issues?
Oh, definitely it
Yeah.
does.
Okay.
It definitely does. And the people who are candidates for it. But I also use, natural forms. I'm a big fan of bioidenticals. But for those patients who aren't candidates for it, I might use more supplemental strategies, more rhubarb or, very low dose things. To really help them produce. Wild yam root is another one of my favorites to help stabilize those hormones. But that's essential, I feel like, for a lot of women, and especially if you're going through those changes. But it's natural. That's why I always tell patients, bioidentical, identical to what we produce in our bodies. And that's what's preferred for brain health.
Yeah, I love that. I mean, there's so many things that women are experiencing at such higher rates, autoimmune conditions, 80% of the diagnoses, 2/3 of Alzheimer. So,
Yeah.
Obviously it's a combination of all these things, the increased inflammation, the changes in hormones. It's so interesting. I'm really obsessed with ovarian, like longevity right now. I just became there's a new ML model, like machine learning model that actually is able to, I think, offer us the most accurate depiction of ovarian age that we've had so far. It takes like AMH, but then other markers, and then it's trained on this huge data set. So that's a bit of a tangent, but we know that when we enter menopause and the ovaries really start to decline, a lot of these, chronic diseases and diagnoses uptick at that point.
Yes.
So if we can push out the longevity of the ovaries, I think that would be such a win for women.
I think so too. And it also can help with hormone optimization long term too. I agree with that. I think that's fascinating, and a fascinating concept as well. And it would be really good when the data comes out and having that exposure that it's encouraged, because we really want to optimize that as far as women. And then going toward to what you said about inflammatory burden and its connection with estrogen, progesterone imbalances, and aging. I think that also holds true for, chronic infections and toxins. I'm actually presenting, HHS is having a Women's Health Summit next week.
Great.
And I'm going to be on a panel where we're talking about chronic infections and autoimmune disease and the higher rates that it happens in women and what those drivers are. Women, we're the strongest people on the planet, right? We have the highest stress rates, especially moms. I'm sorry, listeners, I'm biased.
Yeah.
But at the same time, that leads to higher levels of cortisol, higher demands. Not only that, put on top of that, the hormonal component as well, and how our body can deal with those insults differently. I don't know how many people, the wife, the husband diagnosed with the same thing, husband's no symptoms, wife struggling, same thing might hold true with environmental exposure. So it's time that we start looking more deeper at these differences and start expressing them. That's why I'm so happy. A lot of this research is coming out now about the differences we have in our bodies and deal with things with perimenopause, menopause. But we also have to start including more of the puberty piece as well, because I have, granted, my kids are 9 now, but I have patients. Kids are so kind, so nice. That estrogen, progesterone, testosterone shift, that inflammatory burden shift, you think it's just behavior. No, it's truly a change in hormones, trigger a change in neurotransmitters, also can trigger a change in inflammation. So that could be part of it. Yes, a teen is a teen, but it's also natural occurrences that are occurring in the brain at that time as well.
And what is happening in the brain?
So what's happening is, especially as your estrogen levels fluctuate, like I said earlier, that suppression in those inflammatory markers, that also fluctuates. And that happens during our menstrual cycle as well. I'm not sure if you've ever suffered from chronic infections or toxins, but whenever we have that decreased estrogen, increased progesterone, or vice versa, that's your body sees that as a stressor. Because that's not normal. You shouldn't have these fluctuations in hormones. Your hormones should be stable throughout life. When that occurs, right, that's when your inflammatory burden rises and you have more symptoms. So most of my patients who have chronic anything and they're on treatments, I say do not take a break from those treatments on your menstrual cycle. All right. Any of my patients who might be young kids and they change with their age, or maybe like I had one kid, for example, he had pandas, chronic strep, and he probably had it for years. But once he turned 13, boom, those signals, his testosterone level changed, inflammatory reactions, immune system fluctuates as we age and as our hormones change. And people don't really think as much about the hormone immune reaction that occurs naturally through our lifespan.
Yeah, that makes a lot of sense. I want to dive into Lyme. How it's so interesting to me because so I've seen people come in with Lyme able to resolve it, but there's also seems to be people that like no matter what they do, they can't get rid of it. I mean, Bella Hadid's like a person that I've been really thinking about it a lot. I'm like, with all the access she has, all the doctors that she has, they cannot seem to like keep this under control. Why is that? Why can some people, and well, I guess my first question is can some people completely eradicate the Lyme and the symptoms from their body? And then what is the difference between people that do and people that can't?
So it depends on detection rate, right? So if you come in my office, which I rarely see, and you just got a tick bite or a rash and it's noticeable, of course, if you get your treatment early enough, you're not going to have that very long chronic journey. You're going to be one of those lucky ones. But what'll happen is so many people get misdiagnosed because our standard of care testing, LabCorp and Quest, might miss 60 to 70% of patients. And that's why when we had the Lyme disease roundtable at HHS, we promoted that we need better Lyme disease biomarkers and testing, because that's what's happened. You get a lot of patients who get misdiagnosed, or they go without a diagnosis and it's persistent for years. And we know we used to call Lyme, Borrelia burgdorferi specifically, the dumb cousin to syphilis. And we all know they're both spirochetes. They all cause neurological changes. They can all cross the blood-brain barrier. But with Lyme disease, we see more severity of those neurological changes the longer you have this exposure. And then you start getting, like I said earlier, that autoimmune molecular mimicry piece. But what I also find on brain scans is not only inflammation, but I see a lot of my patients who might have this area in the brain called the basal ganglia that's really in overdrive, really hyperactive. And that's where the literature shows some of the mast cells, these are cells that produce histamine, a lot of them are localized there. So these patients have a high histamine burden. But not only that, if the basal ganglia, the thalamus, and those deep limbic system structures are overactive, then that brain may not feel safe to heal. So it doesn't matter what you're giving that Lyme patient, what great treatments they're getting, ozone, antibiotics, antimicrobials, intensive care. If your brain doesn't feel safe to heal because you've had years of misdiagnoses, you've had now an autoimmune encephalopathic presentation from these underlying infections, and we're not just talking about one, we're talking about Lyme disease and co-infections, then that's a problem. The other thing that I know that happens, and with my organization, ILADS, which is International Lyme and Associated Diseases Society, we're going through a rebrand because we know that none of us Lyme specialists are just treating Lyme.
Yeah.
I don't think that's it anymore. And especially how toxic the world is, all the other things. It's like Lyme is another one of that cherry on top. It kind of reactivates when your body is under stress, right? And if you don't remove that stressor, like that toxic gut, like that toxic environment, like that histamine intolerance, or calm that response down, then you're going to have a longer time. So I think it's due to what impact it's had on the brain and the length of time it's taking you for treatment, how involved it is with your central nervous system, if your brain feels safe to heal, and then what other imbalances are there. And that's when you have to put the puzzle pieces together. And, with patients like, that's people we might hear about in the literature. Like I did a presentation on a news show about Justin Timberlake, and how he came out in the public about his journey with Lyme disease. But like I said, it's layered upon other imbalances typically. And especially my postmenopausal women, sometimes they have a really hard time if their hormones aren't stabilized with getting their immune system to fight this infection. So it's not just the bugs themselves, which are stealth infections and can be resistant pretty quickly. It's the fact that it also leads to a dysregulated immune system and a higher inflammatory burden. So it's vicious, but it's multi-layered.
But can you ever get rid of Lyme completely?
So like I said earlier, people catch it early, sure.
Yeah.
Most of the time, because we've seen Lyme present in animal models where they've been through IV Roceph, and this was in the monkey model, and they cultured them afterwards after their sacrifice, and they still had Borrelia burgdorferi growing, the organism, or present in their body. So we know that these organisms can create changes in their morphology, what it mean biofilm, or remove their cell wall, which happens in Borrelia burgdorferi, or becomes a cyst, which means that, especially if you're in biofilm, your immune system doesn't recognize it when it's surveying the crowd because it's hiding. I like to tell patients it's like an invisible force field that these organisms can create, so they lay dormant. Kind of similar to how viruses do, right? They lay dormant in our body, and then when we have another stressor, they kind of flare, they can have the ability to flare back up again. But you can also get a remission for the rest of your life, right? If you do the right things and you catch it and you treat appropriately and you get your immune system optimized, and you're dealing simultaneously with those basic fundamentals like we talked about: sleep, hormones, gut, toxins. Because when you're treating tick-borne diseases, you have to look at the entire clinical picture if you want to achieve remission. And people do it and they don't have to worry about it. It's in remission. Their body's ready to go. Even if they flare up, they can suppress it.
Gosh, there's just so much stuff going on inside of our bodies, and there's all these like bad bugs in there that sometimes, you just live with. And it just
Sometimes we just live with it. I mean, I rarely see a person who just had that exposure recently. They've been in that moldy home forever.
Yeah.
They weren't sick forever. They've had Lyme disease. Some of my patients had it, transplacental. Their parents had it. Some of my patients have had it and it's crossed the placenta. Their moms had it, right? So it's those things that we talked about, that inflammatory burden that reactivates. I always think of my favorite video, and this is kind of off topic, but it's gonna bring it back. So Michael Jackson Thriller, right? He goes in the graveyard, he rakes up all the zombies, and things start dancing around the body. That's what these infections do. They usually is a trigger, some type of immune system dysfunction, some sort of other stressor that goes in your body, and those things that at one point, hey, you were chilling, you didn't think they were there, they now reactivate and flare up. And we see a lot of that with COVID as well. Lyme, it flares up other things that were present by causing your immune system to be compromised. So people are exposed to all these things. That's what patients always tell me. Look, I was eating junk all my life and I was healthy. Yeah, but now your immune system is dysregulated and you have more inflammation. So you can't do those terrible things that you used to. It's not just one thing anymore. It's all of it combined.
Yeah. Yeah, I mean, I think a lot of people think that kind of how I live is a bit extreme, and it is. It's not the standard, but it's like something is going to happen to most people that can be that thing that tips it over. So what I'm trying to do is optimize as many things that are within my control. Also, I enjoy it, so it's not like by any means am I like, people still ask me like, how do you have fun? I'm like, who defined fun is drinking alcohol and staying up until 3 a.m? What if I think working out is fun? What if I think it is fun to go in my hyperbaric chamber at my house? Like, we can all have our own definitions here. But yeah, it's just so important to control what you can when you can, because something will most likely occur, whether it's a virus like COVID, whether it's a Lyme, disease, and then your body can handle it so much better if you're in a better state.
Yeah.
So
it does occur. It's not sometimes. It happens every single day, especially with our environment, our foods, our air. We talked about the LA fires, as toxic as it is right now. And I think doing the right thing and what you're doing is important. You want to optimize your immune system. And that's what I tell patients. What makes you so special? Like we talked earlier about someone getting Lyme and someone fine, or someone living in mold and another person's fine. What makes that person who is susceptible to these chronic conditions, or has this immune system that's dysregulated, or has this neurological inflammation, who might, if you put them in side by side, be doing the same exact things? That's what longevity is, looking at that root cause to optimize health and to see what might be present in one person's situation versus another. And I think that's key. That's why when we talk about brain scan and imaging, it's so important, because it's about being proactive, optimizing that level of information, but knowing that it's present, doing what you can, which is in your wheelhouse, to be as healthy as possible, because you're optimizing your immune system and decreasing your inflammatory marker so that when you get exposed to X, you're fine.
Yeah.
You know? And I
So
think
important.
people don't look at health that way. They would rather treat the problem when it presents, or they'll rather say, whatever, I'm invincible. But you have to optimize even just your overall primary care life, your food choices, your sleep choices, if you want to effectively fight off whatever burden comes your way.
Yeah. So important. Well, I have one more question for you. I feel like a marker has been pretty popularized lately, p-tau,
Yes.
as like a early detection Alzheimer's marker. What's that measuring, and do you think it's like something that people should be looking at?
Yeah, I just started looking more at the p-tau protein because LabCorp has tests that can look at it and quantify it. So it's more of a warning sign. That dementia has placed you at a higher risk of Alzheimer's, but you can quantify it with LabCorp and implement strategies and see if it fluctuates or not. And I thought that was great. They just came out with that test maybe a couple years ago where you can measure p-tau protein with standard labs. So it's something I measure with most of my patients who've had memory impairment.
And what are some of the interventions that are recommended?
So basically, you look at that, but I'm not looking at that alone. Making sure you're optimizing the hormones, making sure you're looking at your omega. I really like phosphatidylcholine. Like anyone who has p-tau, I'm putting them on phosphatidylcholine because that's going to support the extracellular matrix of your cells throughout your body, right? We're using the right anti-inflammatory. We're using the right, all those things to just optimize your brain and just get ready. It's the same thing when I'm checking ApoE3 and E4. Those are genetic markers that tell you if you're at a higher risk for Alzheimer's. It's just all about being proactive once again. What makes you so special? Like I come from a family history. My mom and my grandmother both had dementia. And I grew up in a home that I think had mold, So these things I'm passionate about because I lived it. I worry about it. I'm proactive about it, about loving my brain and doing the things that I know is going to make it love me back because I have that risk. But you aren't your genes. You can have risk in biomarkers, and that's what neurolongevity is. You have the biomarkers, but how can you optimize your brain inside of those factors? And that's the way I live my life. Having those risk factors, I can't take it away. Luckily, I don't have the genetic markers for it, but I have the family history of dementia, and I'm a woman. Right. And it both occurred in my grandmother and mother as they went through menopause, which we didn't talk about, and had mold, which we didn't talk about. So it's just taking those steps. I'm kind of neurotic as well with doing labs and biomarkers and brain imaging for myself, but it's because I have to, and I want to make sure that whatever faces me, I'm able to address.
I love that. Well, this has been such a pleasure to have you on. Is there anything else that you think that the audience needs to know about brain longevity, neuroinflammation?
Yes, I think, if anything resonates today, it's to be proactive. And that everyone, I don't care how old you are, you need to know the status of your brain. Even if you can't get one of our Amen Clinic SPECT scans, which I always recommend, just having your doctor do basic inflammatory biomarkers, checking for infections if you know you're not quite right, checking for your lab work for hormones, making sure you're sleeping and eating optimally. If you know your brain's, even if it's something like, where'd I put my keys? Like people always think of neurolongevity as preventing dementia. No, we're trying to make you have the best brain, but you really won't know until you look. And I'm a big believer of faith, like having faith in your body, in your health, and believing in something bigger than you will give you the courage to keep going. Will let you know, that even if you can't get started, you believe that there's a way. You believe that you had that good day. So I always start my day with gratitude and be grateful, because any morning you wake up, your brain is working. Right? So that gratitude journal, get you started. And also know that there are doctors that can help. Like, I said, iLads is a great organization, but we're not just treating Lyme disease. We're treating Lyme disease and complex chronic illnesses. Amen clinics, we have functional psychiatry. I have my functional neuropsychiatry, also looking at brain neuroinflammation very intensely, and functional medicine. We have brilliant functional medicine doctors at clinics around the country. We treat internationally. So just asking those questions, but you can always start with the basics. But if you know the basics and standard medicine has not helped you, keep the faith and keep going, because there are doctors that are there for you. It's never too late.
Yeah, I love that. And where can people find you?
Yeah, so they can www.Dr. my name, Eboni with an I, Cornish.com is my personal website where people can go. They can learn how to schedule with me, because my SPECT scan imaging is more based on functional medicine and neuroinflammation. And we also can consult psychiatry as well. Then go to Amen Clinics where they can find me as well for functional medicine. I treat numerous conditions, as you mentioned earlier, with or without a brain scan. They can go to amenclinics.com for psychiatry. I'm on Instagram, and I always do short videos, and that's at dr.ebonicornish. But in conferences, I'm always running my mouth. So I'm not hard to find. I'm always here to help. I love what I do. So just ask away. Ask the questions you need.
Love that. Well, we'll make sure to include that all in the show notes. And thank you so much for being here. This has been such a pleasure.
This has been awesome. You are great. And I'm very proud of you for what you're doing and how you're inspiring others. Keep it up.
Well, thank you. I mean, right back at you. I mean, as natural as it is to you, not all doctors are practicing the way that you are, and not because of probably the best intentions, but it's hard for people to find. And with the rise of functional medicine now, I've just seen it throughout the years that there's a bit of greenwashing now. It's just like, instead of a pharmaceutical, it's like a supplement for every single lab marker that's out of range, instead of looking at the body in a holistic, like, root cause way. And it's very clear to me that that's what you're doing.
Yes.
So anyone that would work with you, I'm sure, would have incredible results and would be very blessed to do so.
Oh, thank you. This has been a blessing. Thank you for the invitation too.
Absolutely. Well, thanks so much.